Hi. So I want to do this question with you. So the question says, a 42-year-old female with a history of GERD disease is admitted to the hospital with complaints of frequent heartburn. Which of the following interventions would the nurse anticipate the doctor to order? A, start the patient on IV fluids and antacids. B, prepare the patient for endoscopy procedure. C, place the patient on cardiac monitoring. D, auscultate the patient's bowel sounds for hypoactivity. All right, so I'm gonna not say something for 30 seconds and allow you to pick the correct to choose the answer, and then I'll walk you through the answer. Okay, so all right, and if you need more time, just stop this video. So this question says you have a 42-year-old female with a history of GERD disease, and they're admitted to the hospital with complaints of frequent heartburn. Which of the following interventions would the nurse anticipate the doctor to order, right? So let's look at this question, right? Let's literally identify what the question is asking us. So here's one thing that's going to help you. Oftentimes, when you see questions like this, the question wants you to pick the answer based on the potential complication, not based on the current diagnosis. One more time. Oftentimes, when you see questions like this, it wants you to depict the correct answer based on what the potential complication is, not based on what is the current diagnosis. So the first one says, A, start the patient on IV fluids and antacids. Now, you may have picked that answer, right? Because you're thinking they need antacids, right? Because they have GERD disease. But here's the thing though, if they have GERD disease, they've been taking antacids, right? That's what they've probably been taking already at home. So as the nurse, we have to take one step further and do the next thing that will help the patient. In addition to that, you're not going to give them IV fluids. That wouldn't be appropriate to give to this patient. So that's the reason why A is incorrect. It has to be the entire statement to be correct. So antacids will not be appropriate because now this is telling you the patient has developed a new problem. All right. Okay, then the next one says prepare the patient for an endoscopy procedure. So what's going on with this patient? First, you know what? Let me give you what the answer is. The answer is actually going to be B, which is going to be prepare the patient for the endoscopy procedure. Why is it B? The reason why it's B is because this is a sign that they have now developed Barrett's esophagus. Barrett's esophagus is a condition that occurs from too much exposure to acids over time. And Barrett's esophagus is usually designated by patients that have history of GERD and frequent complaints of heartburn. So now the nurse is realizing that this is the complication that the patient is experiencing, but we have to first confirm it by doing what? Doing an endoscopy procedure. That's why the correct answer is B. C would not be appropriate because you're not going to do cardiac monitoring because this is not a cardiac issue. And then D would not be appropriate. Auscultate the patient's bowel sounds for hypoactivity because that has nothing to do with, once again, this diagnosis. It's although it is a digestive system problem, this is not specific to that. All right. So you see why it's B. So the biggest thing you have to understand is that when it comes to the exam, and if it's telling you the patient has a history of something and now they're complaining of these new symptoms, this means something. This means now that the problem is getting worse. So you have to be able to decipher what is the complication. You got to be complication focused in order to pass your NCLEX exam. All right, so I hope that helps you. Thank you for watching, and make sure that you click below this video if you're watching this from YouTube. Subscribe if you find this information helpful, because I put out more information like this. And make sure you click the button below so you can sign up for our free NCLEX Predictor test. All right, see you next time.